What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. On this Wednesday, I thought we would start our day off by doing a little video about masking in healthcare. It's something I'm not seeing enough of. And now that we're heading into winter cold flu season and the winter season of COVID, it's something that we need to see more of. And I'm not happy about this. So I just did a delivery a little bit ago this morning. Sometimes when I'm doing deliveries, I'll get something, lunch, breakfast item, could be dinner, doesn't matter, going to a healthcare facility or going to a healthcare place. More times than not, when I arrive at the place, the office, maybe it's on the first floor, second floor, doesn't matter. I see a lot of people that are not masked within the building. And that's a problem. That's a real problem. One of the reasons why we will never slow down the spread of this virus or never stop it, one of the reasons, there's many, there's hundreds, if not thousands, different reasons. One is transmission in healthcare. It's a real problem. When people go to a doctor's office, to a healthcare facility, chances are it's either because they're sick, it's a follow-up with something, and if someone's coming when they're sick, who's to say that person doesn't have COVID? You're not alone. You're not the only one that has to use that facility. Other people have to share those same healthcare facilities. Some who are immunocompromised, some who are high risk of catching COVID or any other airborne disease. When you go there maskless while sick, you are putting them at risk. And it's not just you, the patient. It's also health care workers. I'm very grateful for what healthcare workers do, but I see a ton of healthcare workers unmasked. Whether it be the receptionist, the nurse practitioner, the doctor itself, whoever. I'm seeing a lot of unmasked people in healthcare. And I got a question for you right now. Other than vaccinations and vaccines coming out, what really changed? COVID's still ongoing. COVID did not end. There are still deaths from COVID, which is an undercounted number, though be it not as high as the beginning days of the pandemic. Hey, long COVID, it still exists. Is it you don't want to protect people from COVID because, and this may sound bad, it's because, well, if more people get long COVID, we get more patients. Is that what it is? Sometimes I got to wonder. What is it? Why can't you put on a simple mask in healthcare to not only protect yourself, but to protect other people who must come to your healthcare facility? And if you are a patient, why don't you try to protect yourself by wearing a mask in a healthcare facility, a doctor's office, hospital? That's something I hear about. Crowded emergency rooms. All walks of life go into the emergency room or an urgent care facility with all types of issues, including flu, sickness, COVID, RSV, pneumonia, you name it. And you can't put on a simple mask. If you go there knowing you're sick, you possibly have COVID, hello, put on a mask. You got other people there. Maybe some of them are high risk, and if they catch COVID, it could be life-threatening or even more severely disabling to them than their current condition, or maybe they have COPD. You don't know that. You don't know what the person sitting next to you in the office, doctor's office, emergency room, waiting area, urgent care, you don't know what their condition is. So why not try to keep them safe? Even if you don't feel like you're sick. Asymptomatic spread of COVID is real. You could be asymptomatic, pass it on to a high-risk person that's sitting next to you. They could catch it. And they could have a real rough go of it, and their health condition could get worse, all because you chose to not wear a mask. It's simple. I'm not asking much. All you do is you take a high quality N95 mask, not the blue surgical mask, not the cloth mask. You just go like this. And then there's some that make the case, oh, well, in the mask, no one can hear when I'm saying I'm too muffled. Do I sound muffled right now? Maybe I'm speaking a little bit higher. But do I sound muffled right now? You can still hear what I'm saying. And when people look at me and say, oh, I can't hear what you're saying with that thing on your face, that's a bunch of hogwash. Don't accept that. Don't accept that. They can hear you just fine. Maybe in some rare cases, there's someone that's hard of hearing. Fine. But in most cases, if someone's saying to you, I can't hear you with that mask on, that's just their way of saying, come on, you got to drop the mask, COVID's over. Because I've had it happen to me several times with people that look like they are perfectly fine, willing, and capable of hearing me, and they also look like they're unvaccinated. And you get where I'm going at with this. So please, if you're going to enter healthcare, maybe for a doctor's appointment, I will be entering healthcare later today myself. I have a CAT scan on my lungs. This is all part of that pulmonary doctor, but I'm getting it done at a CAT scan place this afternoon. I will be masking in healthcare. Now, I've had to deal with this place before. Very few people there last time I went there were masked, and there were people coughing. I will try and get an AirNet reading there. We'll see. We'll see. And if I do get one there, I'll let you know in the pandemic update this afternoon, well, I should say this evening, what that reading is. I know we promised to get you a pandemic update out yesterday. We did not. Something came up. Don't worry, I'm fine. Something came up. I just couldn't get to it. We will get one in this afternoon. I have a couple things from yesterday and, well, whatever I find to share with you for today. So again, the moral and lesson learned in this little video right here is, please, if you're a patient in healthcare, mask up. If you're a healthcare provider, you're in an office, hey, there's a new variant out there, JN.1, which is a sublineage of BA 2.86. It's showing up here in the United States. I'm finding out that the CDC is, I don't want to say hiding it, but they are kind of putting it in a disguise. It's already on the CDC data. You know, the Nowcast page, it's there. It's under BA.2. That's why they have BA.2 listed there. We're finding out, well, very interesting. BA.2 means BA 2.86, but they're not saying BA 2.86. More on that in the pandemic update later today. But as you know, when a new variant comes, cases go up. So do the right thing now before it's too late. Start implementing masks again in healthcare. Start wearing masks again in healthcare if you are a patient, healthcare provider, doctor, nurse practitioner, specialist, whoever you are. It's time. Keep yourself safe and keep your patients safe. Thank you. If you learned something, give this a thumbs up. If you want to see more content like this, subscribe to my channel down below. I will see you all again later today for the pandemic update. Thanks for watching. Take care. Stay safe. See you all again later.